of May is Mental Health Month 2023. Thank you for being, yes. Thank you so much for being here today. My name is Lori Marie Peixoto, and I'm the Executive Director of the Mental Health Association of Rhode Island. It's really wonderful to see so many people here today. Your presence signifies how important our mental health is. And it tells our leaders that it should be important to them too. Thank you to all the elected officials who are here today. Thank you to our friends from various state departments and offices who are here. Also, thank you to Jenna Park from Congressman Whitehouse's office, who is here today on behalf of the senator. Well, a year has passed since we were last here, and I'm happy to report there's been progress. There's been positive change. Our leaders heard us, and they took action. Our leaders have invested significant funding, federal funding and state funding, into our behavioral health care system. Here are just a few examples of what we're getting in Rhode Island. $11 million of pandemic relief funds will go toward building a residential treatment facility for our girls. Over $8 million of state funding will go towards children's behavioral health services. Over $30 million in state funding will go towards a new state psychiatric hospital. Soon, we will have new specialized group homes for people with disabilities and complicated conditions. Our leaders approved funding to establish certified community behavioral health clinics, CCBHCs. And Governor McKee signaled his intention to establish an Olmstead Planning Committee in Rhode Island. I'm thankful to Governor McKee, Speaker Shekarchi, President Ruggiero, and all members of our General Assembly for their support, advocacy, and investment, and I think we should give them a round of applause to show our appreciation. These are wonderful accomplishments, and they will surely make a difference in our system and in people's lives. We've made important gains, but there's still so much to do in Rhode Island. We can't pretend this is a new phenomenon. We have waitlists for every level of care, and waitlists existed well before the pandemic. I'll share my own story as an example, just to make this real for everyone. I've lived with clinical depression for most of my life, starting in childhood. In 2016, I struggled for 18 long months with the most painful episode of depression I've ever experienced in my life. I cried every day. I cried in the shower. I cried in the park. I cried in the car on the way to work. I cried while I was at work in the bathroom. I cried on the subway in Boston. I cried on a first date, and there was no second date. This depression was the perfect storm of chemical, hormonal, and situational factors in my life. And at that time, I could not find an antidepressant to work for more than 6 weeks without horrible side effects. I was in agony. I attempted to take my own life on my 40th birthday, but thanks to my loving friends and appropriate services, I stabilized and I slowly inched my way back toward help. By the way, being suicidal made me eligible for transcranial magnetic stimulation on my brain, and I wasn't eligible with that with my insurance company before that attempt. So since that time, I've been in remission. However, in 2018, I felt myself slipping again. I was sliding downward, and I reached out for help. And I called 2 therapists who had the experience, the expertise, and the treatment approaches that I needed. Both of them were in my insurance network. Both of them had wait lists. I can tell you that it is demoralizing to need help, to reach out for help, and then to be told that you have to wait for help. It's also dangerous. Waitlists are caused by staffing shortages, and staffing shortages are caused by poor Medicaid and commercial insurance reimbursement rates, and the chronic underinvestment of our behavioral health care system as a whole. Because of this, many providers no longer participate in Medicaid and insurance networks. Some have stopped practicing in Rhode Island and practice now in Massachusetts and Connecticut, where the rates are higher. Others are on the verge of going out of business because it costs more to deliver services than they can recover in reimbursement rates. I respectfully implore our leaders, please raise reimbursement rates. Please. I'm not the only one who has experienced the effects of an inadequate system of care. People have spent hours in the emergency department for a behavioral health crisis only to be sent home because there were no beds available. Hospitalized children and adults who are ready to be discharged from a hospital are delayed and stuck in that hospital because of a lack of available outpatient services for a safe discharge. What do we need to do? We need to raise the rates. And while those ready to go home from the hospital are forced to remain there, those in urgent need of hospital care can't get an available bed, and their lives are at risk. What needs to happen right now? Raise the rates. So today, right here, right now, I'm telling our leaders that wait lists are no longer acceptable. There can be no more wait lists. Nobody should have to wait for life-saving behavioral health treatment when they are in crisis. It's unconscionable. Please raise the rates. It really doesn't matter what providers in Massachusetts and Connecticut earn in their reimbursement rates, and I know that's always a hot issue in Rhode Island. What do our sister states do? But I can tell you that it really doesn't matter because the providers in Massachusetts and Connecticut are also probably underpaid. All of us expect an annual salary increase or a cost of living increase, and most of us get that, and I don't think behavioral health providers should not be able to experience that. They have to keep up with the cost of living as well. Certified community behavioral health clinics are a good start to rebuilding and strengthening the system. Thank you for funding CCBHCs. Please continue to fund CCBHCs. However, CCBHCs are not a panacea for our broken continuum of care. CCBHCs will not improve the financial health of providers in private practice, and they will not relieve wait lists for people like me who see providers in private practice. We have a whole continuum of care to tend to, and no one part of our continuum of care is more important than the others. We need to ensure all parts of the continuum for every Rhode Islander when they need it. Doing nothing is not free. We simply pay the price later when consumers overutilize emergency departments, hospitals, residential treatment centers, because they could not access treatment at the outpatient level. We must also think of our most vulnerable Rhode Islanders, those with serious, persistent mental illness, which impairs their ability to carry out activities of daily living and requires long-term treatment. About 7% of Rhode Islanders live with serious, persistent mental illness, but about 15 to 20% of inmates in prison live with serious, persistent mental illness, and this is unconscionable. And why does this happen? It's because Rhode Island, like many other states in our country, have neglected to invest in enough supportive housing for people with disabilities. And left to fend for themselves, they often become homeless and then arrested for crimes related to homelessness. We're calling on our leaders to invest more in supportive housing for people with serious, persistent mental illness. We're calling on our leaders to sustain the 988 behavioral health crisis line. Just like 911, 988 saves lives, and we need to have sustainable funding so that it's there for when Rhode Islanders need it. We are long overdue for an Olmsted plan, so let's establish that planning committee so we can get going on that work. And while we've accomplished a lot in 2022, we must keep the momentum going. We must build on those successes. We must consistently fund our behavioral health care system year after year, just like we fund housing and education. We all know someone. 1 out of 5 Rhode Islanders lives with a diagnosable mental health condition or substance use disorder. So maybe today it's me who needs help, but tomorrow it could be you. It could be your child. It could be your sibling. And we have to take care of one another. Thank you. And now I would like to welcome someone who's been a long time outspoken advocate for the mental health community. In the past, she has courageously opened her heart and shared lived experiences with us. She's used her platform as a journalist and a cherished Rhode Island celebrity to elevate and highlight the important issues we are talking about today. She approaches this work with compassion, empathy, and a quest for righting wrongs. Please give a warm welcome to Barbara Morris of NBC 10 News.
Thank you, Lori Marie. I've done this so many years. Every year, I never know what I'm going to say. I just kind of speak from the heart. Many of you know my story. I had a mom, bipolar disorder, who ended up taking her own life. A best friend. I still get sad. An ex-husband, who've all taken their life because of mental health. This has got to stop. It has to stop. Wait lists are unacceptable. We talk about trying to get into someone. There's so many good people out there. They want to help. You can't get in. Nobody wants to take insurance when the reimbursements are horrifying. It is hard out there. I implore, who are our lawmakers in here? Okay? I am talking to you. I'm talking to all of the people who have voted you in. You need to make a difference. This is totally unacceptable. We do need to raise the rates. We need to raise awareness. We need more Black and brown counselors out there. Culturally sensitive, because we have inequities out there. We need to address all of this. I am so passionate about this because it has been a part of my fabric. When my daughter calls me from Denver, trying to find a counselor out in Denver, and I have to call a friend who's a counselor here to try and help her find a counselor there. Oh, and by the way, she's still looking. And when Lori Marie says she would cry every day, my daughter will call and say, Mom, I don't know why I'm crying, but I'm crying. Everything's going well, but I'm sad. Unacceptable that our kids, our parents, our siblings, our brothers, our sisters, our aunts and uncles can't get the care they need. So I implore every single person who can hear me, and I am loud because I come from a long line of preachers. So I don't have any problem preaching up here at the pulpit. All of you in here who can hear me, let your voices be heard. We don't need to lose more people to mental illness. Not one. We lose one, and it's horrifying. So I implore all of you to make a difference, to let your lawmakers know that you want them to make a difference and that this is unacceptable. On the other hand, I do want to applaud all the additional funding that is coming in to make new things possible in this state, much needed. But we have so much work to do. The pandemic did us zero favors. Zero. Our kids are in crisis. In fact, that is my story tonight about teen depression. I could do a story on teen depression every night. Every single night. You need your voices heard. These are our future. These are our kids who cannot get into services unless they are in crisis. Unacceptable. Do y'all agree? I can't hear you. So basically, that's all I have to say. Hopefully I got your attention. Hopefully it is a call to action to everyone in here. Yes, news reporters have issues. We have families with issues. And we should be sharing our stories, every single one of us. I applaud Lori Marie for sharing her very personal story. And I hope that all of you, she says 1 out of 5 has a diagnosable mental illness. 5 out of 5 know someone who has a diagnosable mental illness. Am I right? I am going to pass this back to Lori Marie. Thank you for listening to me talk.
Thanks, Barbara. Thank you so much, Barbara. Thank you for your empathy and your passion and your advocacy. And now I'd like to welcome Director of the Department of Behavioral Health, Developmental Disabilities and Hospitals, Richard Charest.
Good afternoon, everybody. Thank you, Lori and Barbara, for sharing your stories. Very moving, very powerful, and it certainly rings true, and we hope we can do better. So it's a pleasure to be here to kick off May as Mental Health Month. As we recognize the importance of Mental Health Month, I would like to start by congratulating those receiving awards today. The legislators of the year, Representative Jacqueline Baginski and Senator Josh Miller. As well as our Mental Health Hero of the Year, Meg Klingham. So Meg is Rhode Island's mental health advocate, and I know she works on a daily basis for the individuals that she represents. Each one of you has done a magnificent job and significant work to ensure that all Rhode Islanders receive access and parity in mental health care, so please accept my congratulations. The goal of Mental Health Month is to bring attention to the importance of mental health care and change the negative image often associated with mental health conditions. This year's theme, We All Know Someone, speaks to all of us, as Barbara mentioned. With roughly 1 in 5 adults living with mental illness, our lives are naturally intertwined with those who may be suffering. Fear and discrimination keep people at arm's length. Yet as a community, we know we need to talk more about mental health and we need to engage others. While the conversation may be difficult, they need to happen if we are going to create healthy communities that we want. Having candid conversations around mental health continues to chip away the negative perceptions that exist with mental illness today. Recovery is possible. As the state mental health authority, I know that my department cannot do the work alone. We need the assistance of every organization, every advocate, and all of you. We need your voice, and more importantly, we need your experience, your knowledge, and your participation. Everyone, in one way or another, has been affected by mental illness. We are in this together. We stand as part of the collective effort to make innovative changes to our system that are currently underway. With many new behavioral health programs having already started and or about to start, we are confident that we will be on the right track but we need your voice at the table. Please stand with us as we move and change forward, and know that we stand with you and all who live with mental health challenges, today and every day. Thank you very much.
Thank you so much, Director. Please welcome Jeremiah Rainville of NAMI, Rhode Island.
Glad everyone came here. So I live with bipolar with severe psychosis, which means I have mood swings and psychotic features like voices and seeing things. And I think what is really important for me that helped my recovery is working at NAMI, Rhode Island. I've almost been there 12 years, and it's been a godsend that I can actually work. I had family that said, no, you can't work, that's not possible. And I can tell you in 4 months, it's 12 years at NAMI. And there's been other great organizations throughout my life that has helped. I feel it's unfortunate that people aren't getting the care they need, and that has to stop. I had to change doctors because of insurance issues, and that doctor was a good doctor. But because I couldn't pay for those services, I had to leave. And no one should have to go through that. This morning, I was at Dunkin' Donuts after a workout at LA Fitness, and there was 2 homeless people sleeping in Dunkin' Donuts. These workers came, like whatever work they did, and were banging on the window for them to wake up. And then they came in and caused an issue. Homeless people have nowhere to go. They stay in shelters, but those shelters are dirty. People get things stolen, so that's why we see people at bus stops covered with whatever they have. And that's really frustrating. That has to change. Everyone deserves a home. Everyone deserves a community. Everyone deserves a job. And they can get that if we had more compassion. So, to the legislation, senators, we need your help. We can't let vulnerable people suffer. So, I don't know what to say besides that, but that's what I have to say.
Good afternoon. My name is Ernestine Jennings, and I'm here as a board member for the Mental Health Association of Rhode Island, and I'm here to present the award for Representative Baginski. Rhode Island's behavioral health community is lucky to have so many champions in our General Assembly. We are grateful to all of them for their support. Each year, we honor one representative, one senator for their advocacy. Our first 2023 Legislator of the Year award goes to Representative Jacqueline Baginski from District 17, representing part of Cranston. Representative Baginski was elected to the Rhode Island House of Representatives in November 2020. And in the short period of time, she has made an important contribution to Rhode Island's behavioral health care system. Last year, Representative Baginski played a significant role in securing state funding for the establishment of Certified Community Behavioral Health Clinics, also known as CCBHCs, as you see on the lovely stickers today. The budget article was based on Representative Baginski's legislation. Keeping this funding in the proposed state budget was no small feat. Thanks to Representative Baginski's passionate advocacy and grit, the CCBHC funding was not reduced or eliminated. in the budget that ultimately passed. CCBHCs are one step toward transforming our behavioral health care system. They are based on a federal model of delivering integrated behavioral health care and primary care to anyone who walks through their doors. What is most promising about CCBHCs is the prospective payment system, which will help keep clinic doors open for the long term. Representative Baginski serves as the chair of the House Innovation, Internet, and Technology Committee, and she is a member of the House Finance Committee and the House State Government and Elections Committee. Very busy. Thank you. She is a graduate of the Moses Brown School in Providence and of George Washington University. She's the Director of Sales and Marketing for Professional Ambulance, and she's the Director of Darden Consulting. She also teaches CPR to children. Great. Thank you again. With thanks and appreciation, truly thanks and appreciation for her advocacy for mental health community, we are delighted to present the 2023 Legislator of the Year Award to Representative Jacqueline Baginski. Congratulations, Representative Baginski.
Who else here thinks Barbara Morse has a second career as an elected official? I think we tapped into something really great here today. Thank you so much for this recognition. I hardly feel like I can take the credit for this award. Anyone who's been up to this building more than once knows that success here is really a reflection of all the advocates who come up here and advocate so passionately for what they believe in. Legislators are just a tiny part of this effort. So really, this award belongs to all of you. So as if you haven't done enough already, I'm gonna ask for more. You're here in the building. We've got a captive audience that I plan on taking advantage of. We can't stop here. We have to continue asking our legislators for more support. We need to tell them it's time to fully fund CCBHC so that we can strengthen our network of providers, so that we can build more health infrastructure to get people the care they need. Especially throughout the pandemic, people have been misguided, misdirected, mislabeled, misunderstood. It's time we're done missing. We need to get people where they need to go in a system that's manageable and easy to navigate. So in a few minutes, when this program concludes and you walk back up to the second floor and you start looking for legislators to interact with, what are we going to tell them to do? Raise the rates. Thank you very much for this recognition today. I sincerely appreciate it. Thank you.
Hello, my name's Gabriel Joseph. I'm just here to share my story of mental issues. I always was a quiet, studious kid, picked on for wearing glasses, teased and threatened and beaten. I was always teased on a daily basis because I was considered a nerd, geek, herp, take your pick. As a result, for the most part, I stayed to myself. And it was that way until I went to college. I was accepted into URI, but due to developing issues with anxiety and depression, I had a hard time focusing on my work and would experience anxiety when taking tests. Eventually, I failed the program and went to CCRI, where I got my degree in business administration, even though mental issues persisted. I attempted to go back to URI and pursue my MBA, but at the time I started experiencing flashbacks, depression, anxiety, mood swings, nightmares, and difficulty sleeping. It eventually became too hard to concentrate, so I dropped out of college altogether, believing I was incapable, and worked a number of jobs, but wasn't able to keep one. Following an outburst I had at work, I was told I needed a psych eval before returning. After taking the eval, I was diagnosed with paranoid schizophrenia. Being diagnosed with a mental illness was a real blow. I felt alone, helpless. I felt like my life had ended. I stayed at home and isolated. Eventually, my family, growing concerned, decided to make arrangements for me to see someone. I eventually was reluctant due to stigmas I believed about mental health, but after my first hospitalization, I realized I would have to do something. After bouncing from agency to agency, I eventually was referred to Thrive Behavioral Health, where over the years I've learned coping skills to help me with anxiety, paranoia, and depression. I was experiencing through my experience at Thrive, I was introduced to Hillsgrove House. There I found Hillsgrove House to be a place where I could obtain support on whatever I was going through. There, through the work order day, I would do daily tasks which helped me to feel useful and needed. A few days a week, I assist in the employment unit, helping other members obtain employment. Other times, I attend meetings involving clubhouse outreach and membership. I provide input knowing that my opinion really matters and people care what I have to say. Staff are always willing to provide support to members, even in their time of need, even when they're extremely busy. My work at the clubhouse matters to them because they know we as members are a major part of running the clubhouse. At Hillsgrove House, the staff works alongside members. They talk with us, not at us. Members, we look at each other almost like family. We're willing to work together and find that everyone has something unique to bring to the table. Every voice matters. At my worst, I had clusters of nightmares, and at times I would be too scared to even go to sleep. I self-medicated with drugs and alcohol, wreaking havoc on my body and mental health as well. I would awake at night with sweat-soaked sheets and would often at times feel drained and disconnected. I struggled to concentrate and remember simple things. Yet I was able to get a job at UPS and work there for 2 years. Eventually I was fired due to a manic episode I had at work. After getting fired, I felt like there was no place for me in this world because of my mental illness, so I attempted to take my own life. Years of depression and self-loathing have led me to a dark place. I just wanted to sleep. I wanted to have one day where I didn't feel any pain, one day where I didn't feel like a worthless human being. My wife was able to get me into the hospital in time, and I ended up staying in the psychiatric care unit at Kent Hospital for 2 weeks. After being released, I started not to want to isolate as much, and I started to attend the Hillsgrove House regularly and start giving my thoughts to what I could do as a career. And through the resources at Hillsgrove House, like the career scope and continuing consulting with staff, I was able to decide on what I wanted to do, and with the encouragement of staff from Hillsgrove House, decided that I wanted to go into mental health. And thanks largely to Hillsgrove House, today I am currently in my 4th year at Rhode Island College studying for my BSW.
Good afternoon, everyone. I'm Sarah St. Laurent, and I live with complex PTSD, anxiety, and depression. I had a complicated childhood. Both of my parents experienced significant trauma. They never received treatment for it, and by the time I came into existence, they both struggled mightily with addiction. Mental health and feelings in general were not discussed in my family. The adults around me definitely displayed emotion. Unfortunately, they weren't healthy expressions of emotion. They would fly off the handle, and once they were done, they didn't want to discuss it any further. If I was hurt by something that they did or said while they flew off the handle, that was my problem. It wasn't their problem. If I showed emotion, I was either made fun of or told that I was being too sensitive. They said that because I was a kid, my problems weren't a big deal. As a result of that environment, I learned that it wasn't safe to share how I was feeling or show it. I quickly learned that emotions were shameful, and I carried that shame around my emotions for a long time. Once I became a young adult, my mental health challenges impacted the relationships with other people in a negative way. I really wanted deep, supportive relationships. I wanted to feel like I was a part of a group of people who loved each other. But I had never seen that. I hadn't been shown how to get there. I felt lonely. I felt a lot of shame. And I wondered if something in me was too broken to connect with other people in the way that I wanted to. There's a handful of things that helped me move out of that space of loneliness and shame and into having the kinds of relationships I always wanted. The first was admitting that I wasn't where I wanted to be. I wasn't having the kinds of relationships that I wanted, and I had to take ownership of how I contributed to that. The second was therapy and education. I learned about mental health, about trauma, and about addiction, and I processed everything that happened in my life through the lens of what I was learning. At the same time, I practiced emotional regulation skills, and I learned about healthy relationship skills. The third was acknowledging that taking care of myself is essential to having healthy relationships with other people. I had to spend a lot of time figuring out what it meant to really care for myself and figure out how to fit that into my life. The final revelation that helped me was leaning on my loved ones for support, being open with them about the changes that I wanted to see in my life, and asking them to help me practice those relationship skills in a safe way. And they did. They encouraged me rather than shaming me, and that made all of the difference in the world. In closing, I want to encourage each of you to talk to your loved ones about mental health. Don't wait for something to be wrong. Don't wait for a crisis. Have those conversations now and set a path for them so that you have that path when something does go wrong. Thank you all for listening to my story. And now I'm transitioning into our 2023 Legislator of the Year Award. Every Rhode Islander deserves a chance at recovery. We should be able to access treatment and services when we need them, but it doesn't always work out this way. Our next Legislator of the Year Award goes to someone who truly understands the importance of mental health and has been a steadfast supporter of the behavioral health community for many years. I'm thrilled to present Senator Joshua Miller with our 2023 Legislator of the Year Award today. Thank you, Senator. Senator Miller represents District 28, which includes parts of Cranston and Providence. Senator Miller has been a longtime champion of forward-thinking policies to improve Rhode Islanders' health. He has spearheaded countless pieces of legislation to increase access to behavioral health treatment, make health insurance more affordable, and hold health insurers accountable to parity laws. Senator Miller sponsored a bill to establish a harm reduction pilot program in Rhode Island, which was signed into law. He introduced legislation that would allow the use of Medicaid funds to provide housing services to the chronically unhoused. Most recently, Senator Miller sponsored legislation that helped establish and fund certified community behavioral health clinics in Rhode Island, and for that we are particularly grateful. Senator Miller was elected to the Senate in November 2006 and chairs the Senate Committee on Health and Human Services. He was a member of the Governor's Overdose Commission and has served as chairman of several special commissions, including the Joint Legislative Commission to study the integration of primary care and behavioral health. He's been honored by Rhode Island communities for addiction recovery efforts, for his tireless advocacy for treatment for those struggling with addiction. Senator Miller has also received the Rhode Island Health Center Association's John H. Chafee Healthcare Leadership Award for his commitment to justice and equity in healthcare for all. Senator Miller is a graduate of Hope High School and the University of Rhode Island. In his free time, Senator Miller is the owner and operator of several Providence restaurants. Today, we are thrilled to honor Senator Miller for always leading with his heart, and we're happy to present to him the 2023 Legislator of the Year Award. Congratulations, Senator.
So, you know, I stand up here by myself, but I couldn't do this by myself. I couldn't do this without the groups that are up here every day to make this a priority for me, and because of their personal experiences and because it's the right thing to do. And I want to name some of them and let you know about how important you are to me. Lori Marie and the Mental Health Association. NAMI and Reed Cosper. Reed Cosper has been a voice in my head and an inspiration for me for decades, and I want him to know that. And the Rhode Island Medical Society has always been on the right side of many of these issues and should be also understood to help guide me. And the personal stories that we hear today take a lot of bravery, and I want to acknowledge those personal stories. It's something that I could do if I was strong enough or as strong as they are, but I'm not. And so I work on legislation and reinforce it with data rather than the stories that you bring for me to complete the circle around this. That's necessary to get something passed. And I also couldn't do it without other senators and reps that understand these issues and work really hard to make progress every year. You know, Rhode Island used to be a guiding light for many other states around mental health care. And that slowly almost turned on its head. And we now have a team not only of legislators, but people who really understand and care. Some of them who have spoken and have been recognized, but working with Director Charest for the last couple of years has really given me hope that we now have administration that understands and cares about these issues. But I also want to talk as the chair of the Senate Health and Human Services Committee, how lucky I am to have staff who are with me on this. Kelly Oates is here, who's wearing bright blue on your behalf. And our whole committee is women, which I'm really proud of because sometimes they're more willing to share their emotion around an issue and work hard at it. And we have Senator Ujifuza here, Senator DeMario was here, who's a healthcare worker who allows this work to be a priority. Senator DePalma is now chair of finance, and he's a champion that I'm sure someday you'll recognize, who has worked for years to do exactly what these signs say and raise the rates. And that voice is finally being heard, and I think it's really important for you to know that you have these allies. Senator Tokoyan, who you should all know is on our side on almost all of this, and is what I just designated last week the gentleman of the Senate. And we're going to make progress as quickly as next week in getting legislation passed. Next week, we are going to have up for passage in the Senate my bill 277, which was discussed, which will, with the cooperation for the first time since I've had this bill in 5 years, with the cooperation of the Medicaid office to actually help us write the waiver that will get passed to give rental assistance for those who are chronically homeless with a behavioral health condition. So this is real progress that we could not have done with all the people I discussed. And Senator Mario's bill 290, which will really streamline the pre-authorization that has been a real crippling component of not having a continuum of care. That's also going to be voted on next week. And then next week or the week after, we'll vote on legislation to codify for Rhode Island many components of the ACA, including essential health benefits, which will assure our quality of care will indefinitely include behavioral health services. So that's going to be really important to get done. want to acknowledge that Blue Cross Blue Shield of Rhode Island has almost assured that that will go through to the House by giving us language that will really advance it beyond the Senate for the first time in several years on that legislation. So I want to thank you all for coming, and I thank all the awardees and all the people who've helped make me be another voice for all of you. Thank you.
Please welcome Reed Cosper.
I'm here to deliver the Hero of the Year award, and I get to talk a little bit ahead of it. Some words about myself. In 1991, I was appointed mental health advocate for the state of Rhode Island. In 1991, I was appointed mental health advocate for the state of Rhode Island. And in that year, one of the first things I did was I went to a celebration of Rhode Island's mental health system, recognized nationally as a great foundation for community-based mental health for people with severe persistent mental illness. Also in that year, and the system we created in Rhode Island was a closed, unified healthcare system for people with major mental illness. If you lived in any community in Rhode Island, you needed one phone number to find psychiatrists, nursing, case management, housing, supervised housing, hospitalization, a group home, or supportive housing. That was all available in one complete package funded by the state government and by Medicaid. Also in 1991, it was the first year in a decade that the mental health budget was cut. That was the first year of 30 consecutive years of cutting the mental health budget. And over those 30 years, the mental health system that we could have cultivated and addressed emerging problems, that mental health system is in tatters. And I'm glad to tell you that Hillsborough House is a survivor of that good mental health system. And Rich LeClaire is here, who's one of the survivors of that time in our lives. Thanks for coming. I've emphasized the word public health mental health system because it's not the same as the mental health system. The public mental health system uses tax dollars to provide support to people with severe and persistent mental illness. That's a group of people, that's about 4% of our population. And in the years as the mental health system has decayed, those people have moved from services from Hillsborough House and mental health centers to our prison. And as a mental health advocate, the prison staff, not the leadership, the staff recognized that I was interested in prisoners with mental illness, and I was invited over, I think in hopes that I could help in ways that they could not. I was exposed to things that are barbaric. It is unbelievable that we have gone from institutionalizing people with severe mental illness in insane asylums, where at least you get care, to prisons, where you get corrections, you get punishment. I've seen people, there are deaths, there are suicides, there are reckless deaths. I know a story of an obnoxious, mentally ill man who was placed in prison with a predatory sex predator with AIDS, and they knew that they would give him AIDS, and he wound up on the streets with AIDS. I've seen prisoners. I saw a prisoner from the state of Maine who I'd have to call a raving lunatic. He just screamed in an isolation cell 24 hours a day, and he was here simply because the Maine prison system got exhausted by his 24-hour-a-day screaming, and we accepted him for a respite for the other prison. And I was so shocked that these things were happening, and that I got angry. I got so angry I was no longer articulate about it. It damaged my effectiveness as an advocate. I couldn't imagine incremental change in the prison. It needs revolutionary change. The 15% of the prison population who qualify as people with severe persistent mental illness should be in a hospital, and it can be a secure hospital. And because I think, they've had their liberty taken away, and so they can be reintegrated slowly into a community with treatment. And I don't think that will happen in my lifetime, but it is a pity that we've gone from one kind of institutionalization to a little golden hour of effective treatment to where we are now, where the prisons are full. So I'm about to give the Hero of the Year award to my successor as mental health advocate. And I want to say, I told you all this because among the candidates for my job when I retired, there was only one who knew about the prison. That person had been a public defender for 20 years, and it was Meg Klingham. And I'm happy to tell you that she's not as angry as I was, and so she's frankly more effective toward reform than I was. And I'm so glad that I'm here I can give her this award today. Thank you.
Thank you, Reed. Thank you, Reed, and thank you to Lori Marie and to all of you who shared your stories today, because that's really what's most effective in getting the change that we need to the system. So thank you. I very much appreciate this recognition. It means a lot, particularly coming from my fellow advocates. We don't do this work in order to get praise or to get awards or recognition. We do it because it's vital work that we do, and it's so important what we do. But I do appreciate the recognition. It's nice once in a while. We talked about advocacy and effective advocacy. The way I see my position, which I've been very privileged to hold as the state's mental health advocate, we have advocacy with a capital A, which is what we do when we come here and we try to advocate for changes in the laws. And we have advocacy with a small a, which is what I do on a day-to-day basis when representing individual clients who are living with severe persistent mental illness. And in that advocacy, I would also like to recognize the other members of my office who are here, without whom we couldn't function. We have Mariana Almeida, Jackie Burns, Maggie Choon, James Bagley. So I really appreciate them as well. In talking about advocacy with a small a, I'd like to echo some of what Reed so eloquently stated. We really have devolved into a system where so many people are incarcerated solely because of their mental illness. And that is really what, on a day-to-day basis, I'm most passionate about. And Reed said I'm not as angry as him. I am as angry as him. I try to temper it a little bit better. I try to work through collaboration with other state agencies and with the community to try to solve some of these problems. It's just important to note on a day-to-day basis, there are many people who are incarcerated who have severe mental illness on charges like trespassing, shoplifting, vandalism. And they're incarcerated because I think the system is frustrated, and the system says, well, at least they'll get help if they're incarcerated. And I'm here to tell you that's not completely accurate, and that is not the fault of the Department of Corrections whatsoever. It's a failure of our system of care. And that's why it's so important for all you guys, everybody, to be here to advocate and raise your voices and let everybody know what these issues are and that we need to change them. Events like this are important because it does allow the chance for everybody to get together, all different perspectives, all different players in this advocacy game, so things aren't so siloed, because it's only by collaborating, working together to come up with solutions that I think we really can effectuate change. Now, that said, I'm really appreciative. There's a lot of legislation this session that I think is very important towards changing this and really effectuating change. There's legislation funding crisis intervention training for police officers, which is an issue that's near and dear to my heart. I've been trying for years and years and years. And you know, when I was first a public defender 30 years ago, that's when I really started to see the interplay between people with severe mental illness and incarceration and criminalization. So it's kind of been my mission since then to continue to work as long as I can on decriminalizing mental illness. CIT training is great. Police officers are so much more, and first responders, so much more receptive to this type of training in my experience than they were 30 years ago. And that, again, is due to the advocacy and recognizing and reducing the stigma. I think that truly they want to help, but without a system of care, there's nowhere to divert people to, and hence they end up incarcerated. There's good legislation on discharge planning, thank you, Senator Miller, to require comprehensive discharge planning, because I can't tell you how many of those people that I visit at the prison were very recently released from a hospital to a homeless shelter, and then what do you think happens? There's very important legislation, and thank you, Lori Marie, for pushing constantly to develop an Olmstead plan in Rhode Island, which is way overdue and which will help to develop the system of care that we need to keep people in the least restrictive environments and to live their best lives and be a part of the community that we all deserve to be part of. And as I said, I think this is only possible when we all work together, so I really do appreciate this recognition and the work that everybody does, and thank you.
Congratulations again to Meg Klingham, Senator Miller, and Representative Baginski. Thank you all again for being here. I hope everyone will stick around. We need you, we need your voice. We need everyone here to meet your legislators on the House and Senate floors and share your stories with them. The bell rings at 4 o'clock, so shortly before 4 o'clock you should start to see some of our elected officials coming in. Please find yours and tell them your story. If you don't know who your reps and senators are, our friends at Horizon Healthcare Partners have internet access over here and they can look it up for you. Once you finish talking with your elected officials, join us in the Bell area down here for refreshments and mingling. And we would also love to hear the outcome of those conversations you've had with your legislators. A very big thank you to Barbara Morse from NBC 10 News. Thank you for sharing your story. Yes. Thank you to all our speakers with lived experience who opened their hearts and courageously shared their own stories with us. Each time we share our stories, we reduce stigma a little bit. We tell people that it's okay to have a mental health condition or a substance use disorder. We support one another, we build empathy, we build understanding when we share our stories with one another. Thank you again to the elected officials who are here today. Thank you to the Rhode Island Department of Behavioral Health, Developmental Disabilities and Hospitals for your support and partnership. I would also like to thank our fantastic May is Mental Health Month Planning Committee for their collaboration in putting this event together. We could not do this without your passion. Thank you also to the Mental Health Association's indomitable staff, Karen Malcolm, Michelle Miller, and Terrence Charles. This event would not be possible without their hard work and dedication to the mental health community. Thank you to the Mental Health Association's Board of Directors. And finally, I want to express my gratitude to our sponsors. Thank you, thank you, thank you. Our diamond sponsor, again, is Rhode Island College. Thank you for educating our future social workers and mental health counselors. Platinum sponsors, Blue Cross and Blue Shield. Thank you for paying the highest rates to providers and supporting diversity, equity, and inclusion. The Mindfulness and Health Institute at Brown University. Collectively, gosh, we need you now more than ever. Care New England, you guys rock. Butler Hospital, we love you, you're saving lives. The Parent Support Network and Youth Movement Alliance, thank you for supporting our young Rhode Islanders and making a difference in their lives. Horizon Healthcare Partners, your passionate advocacy is inspirational. Thrive Behavioral Health, thank you also for your passionate advocacy. Community Care Alliance, you are a wonderful partner and we appreciate you so much. And Tides Family Services, thank you for supporting Rhode Island's families. Kodak, thanks for your cutting edge work in the community and for your partnership and advocacy. I'd also like to thank our silver sponsors, Coastal One Bank, Neighborhood Health Plan, Rhode Island News Today, South County Psychiatry, Substance Use, Mental Health, and Leadership Council, bronze sponsor, Dove Counseling, and supporters like No Other and the Interfaith Counseling Center of Rhode Island. Thank you all for joining us today. Please talk to your legislators and meet us down there for refreshments. Thank you so much.